Thank you for joining me today. If you can open up with your name, age, and what you do for a living, that'd be great.
I'm Mark, 55 years old. I'm retired.
Oh, you're retired? Excellent.
Yeah.
So, Mark, if you could kind of take me through basically what you're treating or what you've been dealing with throughout your life.
I've several ailments. I've lots of injuries from military service.
Mm-hmm.
Lower back injury, upper back injury.
Oh, so you're a retired veteran?
Yes, I am.
Oh, okay, yeah.
Carpal tunnel in each hand or wrist. Broke my knee, broke my ankle.
Yeah.
So a lot of arthritis, a lot of scar tissue, and pain along. And so I treat that, and I treat PTSD.
Yeah.
And depression.
Wow. And so how long were you in the Army, Mark?
22 years.
22 years.
Well, 3 months shy of 22.
Yeah. And when did you first, I guess start? When did you first get diagnosed with anything, or when did you start noticing you might need some help with something?
I was still serving in the military when I was diagnosed with PTSD.
Yeah.
And of course, I already had all the injuries. The last one that kind of finished my career was breaking my right knee.
Okay.
So that was pretty well, okay, you're finished.
Yeah.
So along with that, losing my career probably jettisoned me a little bit further into the post-traumatic and the depression area.
Mm-hmm.
So I was retired in 2003.
Yeah.
Of course, not by choice.
But you were in the military for 22 years.
Yes.
Yeah, that's a long career.
It was
in the military as well. Yeah.
And loved every minute of it. So,
yeah. And it was basically injuries that the reason you got discharged.
Basically, it was it came down to a medical release, which is unfit for military service because of my injuries.
So when you came out of the military, so when you were in the military, is that when you first were you on painkillers in the military?
Yeah,
was that your first introduction to a prescription medication?
Painkillers, T3s, T4s, and so on.
Yeah. And then when you were retired, I suppose is a better way to say it. And then a certain amount of time went by, and you realized you just were feeling depressed. Did you go to your?
No, I was already in therapy, seeing psychologists and what have you through the military.
Okay.
Before retiring, and I had applied through Veterans Affairs for pensions and what have you, and now they took over once the military released me for paying for my doctor appointments. So I've been seeing a psychologist since, and Veterans Affairs is my provider basically.
Mm-hmm. So what brought you from there to here? What brought you to medical cannabis as a treatment?
Just the fact that I was taking so many pills,
Mm-hmm.
all the different depression pills, and then the anti-inflammatory pills and the pain pills, and a few years back they started clamping down on how many pain pills they would give a patient.
Yeah.
And it started to get uncomfortable.
So did you? So how many pills were you on at any time? Did you build up a tolerance?
Well,
on
I guess that's probably what they were shooting for when they brought in these new rules for pain pills, because people do build up a tolerance to it, and so I went from say having one T3 a day or every 8 hours or what have you to 2.
Yeah.
And then after that it was like, oh, it's not doing it. It's T4s, and it got a little out of hand, of course.
Yeah.
So doctors started to say, oh, we can't issue that. So I looked into other options.
Yeah. And when so how long ago was that?
Probably about a year and a half ago is when I started looking into cannabis or medical marijuana. It was still not that easy to get into then.
Yeah. Even a year and a half ago.
Even a year and a half ago,
That's like yesterday. I mean,
it seems like it.
Yeah.
But I finally, I didn't really convince my doctor, but she recommended I come here.
Okay.
So
when you so is that who you went to first? Did you go to your doctor first and bring it up to your doctor?
Yes, I did. Yeah.
Okay. And how was that received?
Not very good.
Okay.
Already he was not so much accusing, but saying he wasn't able to give me the pain pills that I was asking for.
Yeah.
And so, in his view, I believe would be that I'm just trying to find another avenue, and I really was. But what he didn't realize was I was trying to get right off of the over the counter.
So are you kind of indicating that he was looking at cannabis as like a street drug, or like, oh, he's looking for a fix? Is that what
I think that's
getting?
how he was thinking.
Yeah.
I can't speak for him.
Or that's what you felt like.
That's how it felt to me.
Yeah.
Because he was very set against me even talking to him about it. So,
yeah. So there wasn't really a lot of support there.
No,
for you.
it
So
wasn't.
but did he recommend you come to a clinic? Oh, he didn't. You had to go.
No.
So what did you do?
I talked to my psychologist about it, and she heard about this place through other patients.
Yeah.
And that's who recommended to me that I come here.
Okay, yeah. So you had to leave. You had to go outside your general practitioner essentially to find a specialist.
Yes.
But typically, how it works or at least how it has always worked in the medical system, is that you'll get a referral from your GP, right? You went.
That's basically what I asked my doctor for that day, and that's when he went.
Because you're looking for context, because you're thinking, well, or obviously he's my general practitioner, he knows all my health conditions, so you weren't looking to go outside of his care.
No, I was trying to get a specialist.
Yeah,
and that's exactly what I asked him about.
Yeah.
Or actually, I asked him if he knew about medical marijuana, or if he knew the treatments with medical marijuana, and that's when he kind of
and then
flew off the handle at me and marched me out the door.
Yeah. Oh my gosh. Is he still your doctor?
No.
Okay. I assumed, but I had to ask. No. So your psychologist gave you basically a referral, so to speak, or gave you a recommendation where to go, not a written referral.
Yeah, it wasn't a referral.
She had heard about a
She had heard about
clinic.
this place and said I should give it a try.
Yeah. So so you came into this clinic. I'm assuming the herb clinic here that we're at, and what happened then? So take me through that process.
I was still a little bit unsure of the procedure here.
Mm-hmm.
If I would have to convince a doctor of this or anything, because I don't know. I was guessing that I'm just coming to see another general practitioner, because it's just called the herb clinic.
Yeah.
So when they brought me in and everything, it was friendly. It was a nice atmosphere, and everyone was friendly. And I sat down with the doctor for however long, and he went over my medical background.
Yeah.
And we came up with a solution.
So you put together. So you came in here with a goal, very clear goal. I would like to get off these other prescribed treatments.
And anti-inflammatories.
What were you on? How many pills were you on when you came in here?
I believe I was taking 6 a day, and that
a day.
included the 2 painkiller pills a day as well. So
2 painkillers, anti-inflammatory and antidepressants, anti-anxiety.
I had pills that I could take at any time. Yeah.
Oh, you had on-demand anti-anxiety.
On demand as well, yeah.
Anti-anxiety pills. What,
right.
were you on anything else? Sleep pill, IBS pill?
No, I didn't like sleep pills and stuff, so I just struggled with that. But
yeah. But you were on six
different medications a day, 6 prescriptions.
How did that make you? How did that make you feel every day?
A lot of time throughout the years, I felt the only word I can say is medicine head. Just so foggy and not myself and unable to kind of get in the mood to things because I had so much medication in my system.
Yeah. And how do you feel today?
Much better.
Yeah.
I mean, it's not 100%.
No.
I don't think anything would be, but
Yeah.
very much better. Yeah.
Yeah. So what was your path? So you came. They put you on a treatment plan. You had goals to come
Well,
off
they
those
had
pills.
recommendations that I use certain products,
Mm-hmm.
and so we went with those. And it took a little while to figure out exactly what would work out, but I'm here now 14 months later, and I do certain things, certain types. I do CBD in the morning, a mixture of CBD and THC in the afternoon,
Yeah.
and then THC at night.
Okay. So now, so you, and that works pretty good for you.
For
right?
me, this, I mean, there's still some little hiccups here and there, but
Yeah.
no, it works.
Yeah.
And
Are you on any of those other medications? Or?
not a one.
You're not on any.
None.
You're not.
No.
You don't take
the only
any.
the only thing I
pills?
take is I have a cholesterol. It's the bad cholesterol, and I have to take a pill every day.
Yeah.
But that's
Yeah.
it.
Yeah. Is that because of your addiction to
No, it's-
grade A Alberta steak?
No, it's a genetic thing. My doctor told me. So
okay. I thought it would
there
just
was
be
nothing
Alberta.
I could do about it to begin with. So
I thought it was
No.
delicious Alberta steak.
no. No.
You got to be careful with it. Well, no, that sounds pretty amazing. So do you think? I guess if you were to compare, your life a year and a half ago versus today, what is that comparison?
Well, it's definitely different. I'm not as trapped in my home as I used to be, because feeling the way I used to feel, I just didn't feel like I could manage to do things on my own. But now that I do medical marijuana, I get out more.
Yep.
It's easier to move around.
Yeah.
That's the biggest deal for me, is the fact that I have less pain, and my carpal tunnel, and I can move.
Yeah.
Yeah. I also lost a lot of weight from the past. I was
Oh, really?
quite
Yeah.
a bit bigger.
Yeah. So you lost weight too. So
Yeah.
it's was that even part of the goal when you were in it, or that just happened?
Well, that was before everything.
Yeah.
I was still on the antidepressants and stuff at that time.
Yeah. But you were able to.
But
physically
because
improve as well.
they at the time they would make me gain weight because I was always eating or always drinking.
Yeah.
I still always have a dry mouth, but we all know why.
Yeah. Yeah. Well, all I have to say is thank you first for your service to our country for those 22 years. And,
You're welcome.
and yeah, thank you, and also congratulations with all your progress. It sounds
Thank you very much.
Sounds like a pretty good situation versus a year and a half ago. So,
Yep.
Right on.
Thank you very
Appreciate
much.
your time.